name's Wallskog. I'm an orthopedic surgeon here in southeastern Wisconsin. I just finished a hip resurfacing and I'd like to take a couple of minutes and tell you more about hip resurfacing. Hip resurfacing is a great alternative to a standard hip replacement for a select group of patients, particularly more young, active patients. I think the best way to understand a little bit about resurfacing is to understand how it differs from hip replacement. In hip replacement, what we do during the procedure is remove the arthritic ball of the hip socket and replace the entire ball and put a 6 to 8 inch titanium or metal stem down the thigh bone, and onto that an artificial ball and socket. A hip resurfacing is much different. We're never removing the ball. We just shave the bone off the top of the ball of the hip socket and put a cap, and then put a metal socket into the acetabulum or the patient's socket. People that are candidates for hip resurfacing are young, active patients with good bone. Typically, in my opinion, the best person for a hip resurfacing is a person I see in the clinic that has bad hip arthritis and frankly is just too young or too active to have a hip replacement. Years ago, we probably would tell that patient to come back in 5 or 10 years or to find a new job. And I think we're beyond that. And I think we have other options available for those patients. And I think hip resurfacing is a great option for that patient population. So again, the indications really are a younger person with bad hip arthritis and that has good bone. Typically, the best candidates for hip resurfacing are men less than 65 and women less than 60 years old. Now women, because of the decrease in bone quality that we often see with menopause, we do recommend and we do get bone density tests on women to make sure their bone quality is good if they're considering having a hip resurfacing. Resurfacing is quite a bit different and I think certainly offers some huge advantages. And let me talk a little bit about all the positives of hip resurfacing. Hip resurfacing, as I referred to before, is a bone preserving operation. So by preserving bone, we maintain more bone so that when the patient is older, really I tell them when you are old, you can have a more standard hip replacement. So bone preservation is certainly one of the main advantages. Also, because it's a larger ball than a standard hip replacement, there's better motion after resurfacing. And because there's a bigger ball with resurfacing, there's a lower risk of dislocation. So those are some of the main advantages. Now the other main advantage I would tell you is a much quicker rehabilitation. I did a resurfacing 2 days ago at a small community hospital about 40 minutes north of Milwaukee, and I did the operation about noon and the patient literally went home by 10 a.m. the next morning. So there is dramatically less pain and a very, very quicker recovery. And I think the reason for that, first of all, people may say, well, those patients are younger, they're healthier. I would actually say the majority of the decreased pain and quicker recovery is from less bone work. And I do think that the majority of pain after replacement comes from more bone work involved with a hip replacement versus a resurfacing. Now, certainly there are some risks, and there are some risks with resurfacing that we don't usually associate with hip replacement too. And I would certainly talk to people about not only the benefits, but about the potential risks associated with resurfacing if a patient were talking to me about having the procedure done. Risks. You can have what's called a femoral neck fracture, and what that means is either during surgery or really in the first 6 months, the bone underneath the ball can crack and you can get a femoral neck fracture. Now if that happens, it's very unfortunate and you have to be converted to a total hip replacement, but it is very uncommon, much less than 1%. Also, hip resurfacing is a type of a metal-on-metal implant, and there are certainly concerns appropriately about metal wear. But the Birmingham hip resurfacing that I use has not been recalled, and the results are outstanding as long as it's put in appropriately. There is very minimal amount of metal wear from the resurfacing. In fact, the design is what we call polar bearing, meaning that the ball is actually floating within the socket. So there truly is little metal on metal contact. Your own hip fluid tends to lubricate the lining or the space between the ball and socket. So there's really little to no metal on metal contact. We also worry a little bit about the blood supply to the ball in a hip resurfacing, and you have to be careful because it has been reported that you can have problems with the blood supply after surgery. If that happens, it's rare, but you would have to be converted to a hip replacement. So those are some of the, I would say, the three main risks we worry about with resurfacing that don't exist with hip replacement. But I would tell you the benefits are really far outweigh the risks in the right patient population. Recovery after hip resurfacing, and I alluded to it a little bit. Typically patients come into the hospital the day of surgery. Surgery itself takes about an hour, sometimes up to an hour and a half. After surgery, people are usually up and walking the day of surgery. I tell patients to expect to be in the hospital 2 days after surgery, but I've been shocked how many people actually go home the day after surgery. But I'd rather tell them that they're going to stay 2 days, so if they go home post-op day 1, they're not disappointed. If they go home post-op day 2, they're not disappointed, but if they're able to go home post-op day 1, they're pleasantly surprised. Then patients have physical therapy for 4 to 6 weeks at most. Patients sometimes use a cane or a crutch for 3 to 4 weeks. Limitations after resurfacing really involve no twisting on the involved leg for 3 months after surgery, and really no running, no jumping, no contact sports for 6 months. After that, you can be involved in activities as tolerated. I have a patient that's a martial arts expert. I have a professional water skier. I have people that do rock climbing. I had a gentleman that did a full 26-mile marathon 10 months out after surgery. I actually have another marathon runner having his hip resurfacing coming up soon. But overall, the results are outstanding. The rehabilitation is very rapid. Most people to an office job are back to work within several weeks, and even active jobs often within 6 to 8 weeks, which is much quicker as compared to a standard hip replacement. So I appreciate the time and going over hip resurfacing. Be more than happy to see you and talk about resurfacing if you feel you may be a candidate and are interested in it. Thank you.